So good morning. It's been estimated that around 14 million of new people will be diagnosed this year and every year for the following year for having cancer. 2 million out of them estimate to be women with breast cancer. Between 30 to 60% of breast cancer patients experience cancer-related fatigue, CRF, and I will use this expression, this shortcut during my presentation, and cognitive disturbance during and after the oncologist treatment. CRF can persist for years post-treatment, and survival describe the CRF as more severe and pervasive and debilitating than normal fatigue, which caused by lack of sleep and overexertion. CRF negatively affect quality of life, and the most important thing is the strategy for CRF management. The conventional treatment, there is no conventional medical treatment for this CRF phenomena during and after chemotherapy and radiotherapy. So basically, the medical recommendation are concerning lifestyle, like walking, yoga, meditation, and so on. But there is no like a medicine or medical approach for dealing with this CRF. Supportive and palliative care play an important role in cancer treatment, and homeopathic treatment can improve quality of life. There are a few articles that fails to see real difference between homeopathic treatment and placebo, but the conclusion was that they saw some effect with the quality of life. And in our last article that we published in Integrative Cancer Therapies in 2017, we recently show a significant association between beneficial effect of homeopathic treatment and fatigue in breast cancer female after radiotherapy. So actually what's happened is that I was working in Sheba Medical Center as a homeopath in an integrative unit, and I saw cancer patients and give them remedies. And this work was a retrospective work, and the main conclusion were that most of the patients that I saw were females with breast cancer during and after radiotherapy, and they have the best improvement with the homeopathic treatment that I gave them. So we decided to progress into our current study, which I present today, and its aim was to evaluate the effectiveness of homeopathic treatment compared to placebo in ameliorating fatigue and attention disorder among women with breast cancer after chemotherapy and during radiation. It was designed as a double-blind and randomized study. Okay, the inclusion criteria were invasive breast cancer after surgery, lumpectomy or mastectomy. All patients received chemotherapy, the usual protocol of AC and Taxol, and all patients started to receive radiotherapy. So this is just a figure what is the machine of radiation. And radiation is a therapy that using ionized radiation that damage rapidly growing cells, such as cancer cells, which are more susceptible to affect radiation therapy than a normal cell. Radiation is given in small fraction, and it is usually in consecutive days for total period of several weeks. Radiation itself is not painful process, and the most side effects are fatigue, skin redness, and small possible burns. So our group is women with breast cancer after surgery, chemotherapy, and they are going to have to start a long and exhausting radiotherapy for a duration of at least 5 weeks. This is the study designs, okay? So first of all, of course, there is the history, and we recruitment the subject, and then we make 2 tests, which I'll explain later on, the EMG and the FSH questionnaire, and we test them at after the first radiotherapy session, because we didn't want the anxiety of the first session. You know, this is first time for them, will influence the results. So after the second or before the second assessment of session of radiotherapy, and then at around 2 weeks, 4 weeks, and then usually the radiotherapy stopped at between 4 and 5 weeks of radiotherapy, and then they continue to take the homeopathic protocol for another 4 weeks, the homeopathic protocol or the placebo. And then we make another assessment at the 8 weeks, which was the end point of our research. And then all of the patients receive the actually homeopathic treatment, okay? And this is very important, because at the end point, there were some women that said, thank you very much, I do not need the true homeopathic treatment because I know that I got the treatment, because compared to my friend, I feel much better. So this was a very good sign for us during the research period, and really encourage us with this protocol. Okay, so it is a randomized process, double-blind procedure, recruitment, sign informed consent, all staff member, physician, nurse, the technician of the radiation, the experimenter did not know what they get. It was blinded to the placebo versus the homeopathic. So how it goes? So the moment that a patient was recruited and signed the informed consent, she get a box with 5 tubes, I will mention it later, 5 tubes of remedy, and with a serial number, okay? A serial number on the box and on the tube, and we do not know, of course, what is this serial number means. The pharmacists who make the preparation have the code, and it was in another city, another place, no connection between us, the hospital, and the pharmacies. Okay, so there was 39 patients who received the homeopathic treatment. It's two-thirds of the patient, and 18 patients received the placebo. So it actually was 57 patients. So the first method which I want to present is the FSH questionnaire, which is, this is the valid method for estimate fatigue in the literature, in the research today, before our research. And the women get a questionnaire which they have to fill by themselves, and they have to estimate the severity of the fatigue and how it disturbs them for the life and for the common life. And for example, there are quite a not simple question. For example, in the last week, what was your estimation between 0 to 10 of fatigue in the most severe day of fatigue of this last week? Okay, so I specifically mentioned it because I was sitting in front of those women, and there was really with this attention disturbance, and I saw the way they fill up the questionnaire. And we knew in a preliminary research that we have done that this is, for us, it's not an objective tool. It is a subjective tool. So we wanted to establish in our research an objective tool to assess the fatigue. So this is our objective tool. This is an EMG of the orbicularis oculi. As you can see, there is an electrode below the eyes, and there is an earphone, and here's this device, which is sound, a background. The experimenter is hearing all the time a background noise of 57 decibel, and suddenly he hear a boom of 114 decibel for 40 milliseconds, which cause him to blink, okay? This is called the startle response. We can measure the intensity of the contraction, and the usual is 750 millivolt. The more the fatigue the person is, the lower the intensity of the contraction. Okay, is this understand? Perfect. Okay, this is the first assessment. This is assessment of the muscle power for contraction. Go down with fatigue. The second one is this machine can measure the percentage of the blinking when the noise is heard. So not every time when a person will hear this noise, he will blink. The normal is around 80%. Okay, so the more the fatigue is, the patient will blink less time. Okay, and this assessment is a neuronal path, is a way to assess the neuronal path between hearing and giving the contraction of the muscle. Okay. And the third one is called ASAT, Auditory Sustained Attention Test, which it measured the reduction of acute startle reflex following the presentation of pre-pulse. So what it is, okay, they hear the 57 decibel, suddenly they hear a little sound above 69 decibel, and then a stop, short stop, and then 114 pulse, okay? So the first time, it's a usual startled response. But in a non-fatigued person, he remember that it's coming. So the second, the third, the fifth time he hear the pre-pulse, the 69 pulse, he ready that he's going to hear the boom. So he prepare himself, and the result is that the voltage of the contraction is less. Do you understand it? Yeah. Perfect. Okay, so 57 patients, 32 of them had mastectomy with reconstriction, 5 of them without reconstriction, 20 of them have lumpectomy, chemotherapy 39 prior to surgery, 18 after surgery, and radiotherapy 25 to 28 fraction, and some to the axilla, to the breast, supraclavicular. Some of them had a boost of 4 to 5 fraction. Okay, wow, I have to run. So, first of all, here there is the table that we want to check whether all these changes actually affect the results. So no, there are no differences between the placebo and the homeopathic treatment group. Okay, about the questionnaire, we can see that the homeopathic group and the placebo group were actually, of course, start with level of severity, but there was no differences between the homeopathic treatment group and the placebo group. Okay, so now it's the main results. Graph A showed the eye blink. We can see that, of course, at the beginning, as I told you, the normal is 80%. They start around 70 to 60% blinking. And there is no difference between the group during the 4th week of treatment. Then radiotherapy stopped, and then they got a difference between the homeopathic treatment group and the placebo group. It was 0.058, so it's not a well, it's a tendency. Okay. With the muscle contraction, the startle response, you can see the fatigue, but there was no differences between the group. And here, with the ASAT, during the 4 weeks, there was no difference, but at the 8 weeks time, there is a significant difference between the homeopathic group, which is the red treatment, and the placebo. Actually, you see that what has happened here and here, that concerning the neuronal aspect, there is a deterioration of the placebo group without any radiotherapy, okay? And there is here a little bit or the same level as the beginning, and here there is a recovery of their attention abilities after homeopathy. I don't know why I did not see this slide, but what we gave them is carcinosin 30C once a day in the morning, radium bromatum 30C, phosphoricum acid 30C, X-ray 6C, and phosphoricum acid, radium bromat, X-ray, and carcinosin, maybe I forgot something. Cadmium sulfuricum, thank you, John Lionel. You're the best. Cadmium sulfuricum because, yes, we discussed it. What is very interesting, during our period of time, there was 5 patients who developed sleep disturbance due to hypervigilance. So it's not a significantly statistic, yes, but it's a very important science because we decided to do it in a very, I don't know how to say it in English, pushy way, yes, to give the remedies a few times a day. So it's a one-shot opportunity. It's very expensive, very, very expensive to conduct such a research. So I wanted it to happen. And during the research, I was quite happy that there are some side effects. What is the side effect? Well, the duration of falling asleep was a little bit longer. And the moment I reduced the frequency of the remedies, it's got better. So our conclusion that specific reason-selected homeopathic remedies, potencies, and protocol of administration ameliorate fatigue during chemotherapy in breast cancer patient, result from the chemoradiotherapy, result from the SAT and startle eye blinks patterns suggest a neuronal recovery with homeopathic treatment. And following this new objective evidence, we suggest to consider treating cancer-related fatigue and cognitive disturbance in breast cancer patients with this homeopathic treatment. And we hope that further investigations are coming. These are my colleagues, Dr. Merayv Ben-David from Sheba, Professor Avi Avital from the Technion, Talia Dolev, and Salman Zubidat. Thank you for attention.